Hi, I'm Marty Lim and I am a licensed physical therapist. What is your understanding of the role of dentists in healthcare? So, ever since I've always associated dentists with hygiene, now I know that they prevent and treat oral diseases, they correct any dental irregularities, as well as treating injuries in and out of the mouth. So that is, I believe, a good thing, since providing proper oral health care can also enhance an individual's mental and overall health. Have you previously collaborated with a dentist in patient management? Unfortunately, I haven't had a patient where I would be collaborating with their dentist to provide their treatment, but I do know that that is possible, especially if the area of treatment is the TMJ, or the temporomandibular joint. Have you collaborated with a dentist in other professional contexts? If by professional context you mean working on a seminar together or something similar, unfortunately I haven't, but I am open to working with dentists to provide proper patient education to those who need. Have you envisioned your profession collaborating with dentists in patient care? Like I have mentioned, collaboration between a physical therapist and a dentist in terms of treating TMJ disorders is possible. Working with dentists will be a great learning experience for me to broaden my knowledge, as well as to provide proper treatment to patients in need. Thank you.
Hi everyone, my name is Joshua Tuale. I am 23 years old and I am a registered nurse currently working here at Silliman University Medical Center. What is your understanding of the role of dentists in the healthcare? My understanding of dentists being a part of the healthcare is that they focus more onto the oral care for patients. As we all know, each patient is different, therefore their feelings are subjective and can be different over time. And these dentists focus more on treating certain conditions and making sure that these conditions doesn't worsen over time. Have you previously collaborated with a dentist in patient management? Currently, I'm still 3 months into my job as a nurse. I'm focused on pediatric care, and currently I haven't been in communications with any dentists, but I'm open to collaborating with them in the near future. Have you collaborated with a dentist in other professional contexts? Again, I haven't, since I'm still new to my field, but I am open to working with them in different types of contexts in the near future. How do you envision your profession collaborating with dentists in patient care? I believe that the nurse-dentist relationship can definitely push the patient's healthcare to the highest standard. This is because dentists are able to accurately provide data that could possibly supplement the condition that the patient is currently experiencing. Therefore, they're able to communicate in an open context to the nurse when it comes to providing the accurate care that the patient actually needs. Because nurses generally provide the assistance to the dentist. Therefore, I believe that the relationship in itself can definitely thrive and, again, overall provide a better context and a better understanding to patient care.
Good afternoon. I am Rima Macariola and I'm a pharmacist by profession. I'm here to share with you my views or insights to the following questions raised by a dentistry student. First, what is your understanding of the role of dentists in healthcare? Dentists play an important role in healthcare because many illnesses emanate from poor oral hygiene or oral care. Second, have you previously collaborated with a dentist in patient management? No, because there is no dentist in our area. Third, have you collaborated with a dentist in other professional contexts? Yes, but just on a personal level. I was the patient myself and I suggested that patient counseling must be done by the dentist himself or herself, not just by the dental assistant, to ensure proper compliance of the medication or dental care after any dental procedure. Fourth, how do you envision your profession collaborating with dentists in patient care? It is really important to collaborate not just with dentists but with all other prescribing professionals so that we can give to the patient the optimum outcome of their medication or drug therapy. Thank you.
My name is Don Rahel Niqua Escula. I graduated BS Occupational Therapy at the University of Santo Tomas. I am not yet an occupational therapist, but I'm currently reviewing for the licensure examination this June 2024. So, for question number 1, what is your understanding of the role of dentists in healthcare? For me po, dentists play a crucial role in healthcare by focusing on the prevention, diagnosis, and the treatment of oral health issues. So they teach on how to care for one's teeth, to prevent oral diseases such as cavities, gum disease, and even oral cancer. They provide guidance on proper oral hygiene practices, including brushing, flossing, and diet. And they can also help in improving one's quality of life by boosting one's confidence, by improving their smile and overall appearance, especially in this part of the face. For questions 2 and 3, honestly, I haven't had any opportunity yet to work with dentists in my field and in other professional contexts. But I have knowledge that we occupational therapists may collaborate with dentists in addressing the concerns of our patients, especially when these concerns affects the occupation and way of living of the patients. For question number 4, how do you envision your profession collaborating with dentists in patient care? So, as an occupational therapist, I envision myself collaborating with dentists in many ways, especially in supporting patients' overall health and well-being, particularly those with special needs or disabilities that affect their ability to maintain good oral health. So, as an OT, I can assess patients' fine motor skills, coordination, and sensory processing abilities related to oral hygiene practices to identify any challenges the patient may have in brushing, flossing, or using dental hygiene tools effectively. Some patients also may experience sensory sensitivities that make oral care challenging. So as an OT, I can provide sensory integration techniques and desensitization strategies to help patients become more comfortable with dental visits. As an OT, I can also provide behavioral support, such as developing coping strategies, relaxation techniques, and behavior management plans to enhance their ability to tolerate dental procedures and minimize the stress. Because as some people, whenever they do dental procedures, whenever they go to the dentist, they may have anxiety and distress when doing these procedures. It may be due to, like what I said before, maybe due to sensory issues, like maybe they're scared of the texture of the toothbrush or the texture of the different apparatuses or tools used in the dental procedure. They may also have like fear of noise when it comes to the different dental tools that is being used. Like for example, the letter toothbrush, maybe they're sensitive to that particular noise. So as an OT, I would modify, I would give suggestion, or I would provide sensory activities just to desensitize them, to prepare them to undergo the dental procedure. So these are just a few examples of how I envision myself working or collaborating with dentists. And there are still many ways as an OT that I can help or collaborate with dentists, or I could provide to the dentist in order to have effective collaborations. So examples of these are environmental modifications and recommending adaptive devices and many more. That's all. Thank you.
I'm Carissa Minatuan and I am a registered provide all the dental treatment that we need. Just like any other healthcare professionals, they do healthcare teaching, they provide treatment and prevention on diseases, but they give importance on oral or dental healthcare. I've been working as an ICU nurse and I have never experienced working with a dentist before. But if the situation arises, I think that it would be really good to collaborate with a dentist in patient management, especially for patients with lifetime treatment. No, I have never experienced working with a dentist before, but like I said, I think that working hand in hand with a dentist in patient management or in other professional contexts in that matter would be a very good opportunity for any patient management. I rarely see us working with a dental team in the hospital, not unless the patient has a due appointment with the dentist for their treatment. But I think if we work closely with them in the future, it would improve our access to oral health care and enhance the oral health promotion and disease prevention for our patient management.